Suzanne was found missing on Mother's Day in 2020. Her body was found, and an autopsy report finally, this many years later, showed a really, really bizarre set of tranquilizer chemicals in her body. It's called BAM. What a terrible acronym, right? It's a potent, potent tranquilizer. See more photos. This is a real person. Sometimes in medicine, we say, oh, 47-year-old woman, 58-year-old man, 12-year-old boy. We don't recognize these are human beings we're talking about who have real lives. She's a mother of two, has a husband, and beyond the scope of our talk today about specifically what the tranquilizers were that were found in her body, but her husband was suspected of being the killer. And I will say, this recent autopsy finding doesn't necessarily support the cause. Now, I'm not here to comment one way or the other, of course, but we're going to talk about, you're going to learn about what BAM is, how it's different than overdosing on anesthetics here that we use in the operating room in humans, and specifically what is now so much more suspicious in the husband's case here. Well, in short, he was found to have a tranquilizer gun. It wasn't working, supposedly, not functional. But when Suzanne went missing that Mother's Day, when she was going on a bike ride, well, very tragic about what happened and why was there BAM in her body? Well, the B in BAM stands for butorphanol. It's funny because butorphanol is actually used in humans as well, but this BAM, which is the combination of B and two other chemicals, is used in big animals like horses, in piggies that we'll talk about, and even in lions. So the question is, the butorphanol, it's also called Stadol when used in humans. We actually don't use it much at all anymore. I've never prescribed it to a patient. It's a really old opioid. It's reversed by naloxone. It's going to cause respiratory depression, and certainly it's going to have a sedative effect when injected at high enough doses. You probably know about that one. The next is the Zapparone. This is very different. We don't use this in human beings. It's a dopamine antagonist, which puts it in the same class of medications like haloperidol or Haldol or metoclopramide. So similarly, just how Reglan, what we use here in the operating room, can help reduce nausea, so can this dopamine antagonist. So can, for that matter, haloperidol at low doses. It also has the anticholinergic, meaning anticholine, anti-acetylcholine, and antihistamine properties. But its main effects probably come from a combination of these three. Now, it's actually used in pigs quite frequently to help with calmness so that they can accept new piglets into their, I don't know what a group of piggies is called, but you can imagine having a calming effect in an otherwise aggressive individual. It's like when we use it in the emergency room. Because remember, we do use haloperidol in the emergency room to calm combative patients. It's interesting that we are giving piggies this medication, and then human beings are eating piglets. Have you ever wondered this? You know, I'm actually curious in the comments here. I'm looking at you guys live. Hey, Jessica, I see you there. Who here has heard? Who here knows that our animal consumption, or I'm trying to say the meat that we eat has these chemicals in it? Did you know that? Let me know below. I'm very, very curious if anyone else knew this. I did not know that pigs that are used for human consumption can have dopamine antagonists injected in them. And Emily, I'm happy that now you know what Stadol is. So, yes, Sheldon here apparently did know. Yeah, the animals get all sorts of chemicals injected in them, not meant to fear monger, but always good to know that hopefully the animals that we're eating are, if you can figure out what source they come from, that it's helpful to avoid them having tranquilizers in them. Who knows what happens to them when humans eat it? But I see I'm not the only person here who was surprised. Jessica, Caitlin, Susie, Patty. Good. We all learned something new. Miss V. Okay. Moving on to the haloperidol very briefly, just so you know, when we give haloperidol in the emergency room to combative patients, like patients who are acutely intoxicated with methamphetamines, maybe with cocaine, no, not so much. You give it to them IV or in a shot. Very, very low doses, hopefully, will calm them down. Though if you use these medications for extended periods of time, even things like metoclopramide, you can have tardive dyskinesias. So I don't want to get out of the veterinary thing, but because so many of you listening have struggled with gastroparesis or other conditions for which you might be taking metoclopramide or Reglan, you got to know that these can have permanent side effects involving tardive dyskinesias, meaning those weird mouth movements that maybe you've seen people who've taken antipsychotics for very long periods of time have those weird facial tics and those funny movements with their lips and tongue. So they come from antipsychotics, and this is one of them. And if you are learning something new, hey, hit the like button and share what you've learned with others. And remember that you can always join our exclusive access for our private Zooms where you can ask more questions. Our live Q&A is coming on at the end, but in general, that's a great place to learn more. The third is the M, metatomedy. This is very closely related to the other alpha-2 agonists that we use in human and veterinary medicine. In animals, we use xylazine, though if you're in San Francisco, we can also get it on the street. It's a very, very potent tranquilizer. The human version of this is called dexmedetomidine. You may even hear the difference between medetomidine, that's the one that is used in veterinary medicine along with xylazine, but medetomidine and dexmedetomidine. So the dex is a stereoisomer, meaning it's like just a reconfigured part of the molecule of medetomidine, which is the version that has all the different isomers within it. Point being that you should watch my videos on this, but this is a trick that big pharma always pulls to take a medication that works, take one part of that medication and repatent it. It's called a patent extender. Now, in this case, we don't use medetomidine in humans to thereby make dexmedetomidine to charge patients more, but very interesting how similarly related they are. Unfortunately, alpha-2 agonists do not respond to naloxone for reversal. So when patients here in the streets are having a tranq overdose, tranq referring to xylazine, similar to medetomidine, which is what is a part of that BAM, B-A-M, M is medetomidine, naloxone won't work. There is a reversal that is not used in humans. You can see it here. I have never given this. We don't have it. But when we want to reverse animals in veterinary medicine, we can use this. It's actually quite effective, especially in lions. Now, what breaks my heart here, you got BAM, that's the science part, but what breaks my heart here is, this is before we launch into our Q&A, is that a lot of the things that happen in this case demonstrate a huge failing of professionals, I should say. What do I mean by that? When Suzanne was found missing, investigators were quick to pin this on her husband. Her husband had a tranquilizer gun. At the time, we didn't know that she had BAM in her body. It probably led to her death because when you stop breathing, or if your heartbeat goes so low and you become hypotensive or have very low blood pressure from the medetomidine component, which is what can happen with a high enough dose, and you pass away, the tranquilizer gun is very suspicious. But at the time, they didn't know it. That's what she had in her body. Now that they know, he might be back in the spotlight. I don't know, right? But what I do know is that a lot of emphasis was placed on him. And Suzanne's family, including her daughters, felt that the investigators had tunnel vision or had too much pride to say they're wrong. And I just got to say, this reminds me so much of doctors I've met who have been egotistical, to say the least, who have had too much pride to say that they're wrong, who have gaslit their patients, who have maybe taken advantage of a position of power to give up the responsibility they have to take care of those who don't have that power. Once again, I'm not saying that investigators did the wrong thing, but when I hear those words, I'm obligated to say that if you have ever felt that your doctor has gaslit you or has blown off what you felt, hasn't given you the care that you need, we're going to have a whole video on this in our next live, by the way, on what to do when someone gaslights you. I hope that you feel empowered to advocate for yourself, because you all have more power over your health than you've ever been told. That's why I hope that you're listening to this channel so you can learn how to better speak up. And doctors anchor, meaning they think maybe it's one particular diagnosis and we're stuck on that, and I have been guilty of this as well. And it can lead to tunnel vision, which is just eerily similar to what Suzanne's two daughters were seemingly talking about the case. So with that said, I am so sorry that Today's topic was so tragic, but I hope that you learned something new. And like Heidi says, thank you. If you learned something, please consider joining. Your support helps me do this more often. I'm so happy to see you all on here. Relinda, I'm very pork sensitive. I usually get really sick after eating any pork. I'm also allergic to Stadol, to a lot of other pain medications. And the only nausea, well, you don't get BAM in your system, is what I would say. Rolinda, I'm sorry to hear about that. I hope that you have found other medications that can help you get your pain under control, get your nausea under control without having allergic reactions. Mike, just happened to me. Mean anesthesiologist. Mike, I'm so sorry to hear that. I hope that the rest of your surgery has gone well. I hope that everyone here can send you positive healing energy. Where was she found? Was she supposed to be there? B, so she was, it's not, I believe, disclosed exactly where the body was found. It was found much later. She had gone on a bike ride. The bike and helmet were in two different places than where the body was found. So I don't know specifically where this triangulated evidence has fallen, but it is clearly distressing that people are using such potent lying tranquilizers in humans. And I really hope that we can, like Caitlin is saying here, try to untunnel vision ourselves when individuals are vulnerable and when we're in the setting of such tragic scenario. So I'm trying to recall what drug you said in a prior video used to reduce the burning of propofol. Was it lidocaine? Yes, it was. Which is better for nausea, Zofran or promethazine? Well, there's no better. You got to talk to your doctor, but promethazine can have more side effects than Zofran on average. It's not medical advice. I'm having a colonoscopy tomorrow. Keep me in your prayers. Nana, I hope everyone here is sending you positive healing energy. And Susie Style, the husband had a tranquilizer gun. Very suspicious, I agree. And Gloria, my youngest brother had developed TD due to long-term use of Latuda. So TD is tardive dyskinesia. That's what we're talking about, having the long-term side effects from medications in the antipsychotic class. And yes, Emily, very, very unusual where they found her, especially so much longer. And Neuropilot, I will say promethazine can be given IV, but you got to give it slowly typically. And IM hurts a lot, right? So let's do one last question. I didn't know that antibiotics animals are treated. We get transferred when eaten by humans. Okay, so Gloria, this is a huge, huge point. When animals have something in their bloodstream, when they die, it's going to stay in their bloodstream. Now, it might decompose. It can metabolize through any number of mechanisms or denature, as we say, for proteins. But yeah, when you eat that, now you presumably are going to cook this, so it might break down in there, but it might break down into all sorts of other metabolites or toxic byproducts that aren't favorable to eat either. So it suffices to say that if you have an opportunity to eat meat that does not have these chemicals in it, it's probably better for you in the long run. A rather crazy theory that some people have, and I'll just throw it out here for you to consider. When people talk about having animal meat from animals that live naturally, they will go on this theory that if an animal dies by unnatural means in a way that there's a lot of epinephrine or norepinephrine in their bloodstream, meaning it'll be in their muscle when they die, well, when you consume that animal muscle as animal meat, you're also consuming all those stress hormones as well. I have a lot of issue with this theory because who knows what's happening to the stress hormones through the process of cooking it before you even eat it. But it is worth considering what is in the mindset of that animal as you're consuming it. Is perhaps the mind state of that animal somehow transferring into you? I'm not going to go so far as to say that, but I will say that it's worth considering. What is the life of the animal like? Because even if it's not directly in the muscle at that moment that you're eating it, if this animal has lived in fight, flight mode for years at a time, it's probably going to affect the quality of that meat in many ways. Do you want that meat coming into your body? Well, it's a nuanced question. Maybe some people have no other choice. Maybe some people are okay with it. But I would advocate that out of a precautionary principle, if there is an alternative, why not seek an alternative if it's accessible? Oh, okay, I'll end with this. Does taking gabapentin and Klonopin together repress or suppress the respiratory system? Well, that's something you got to talk to your doctor about. Yes, they theoretically can't have additive sedative effects, but you got to talk to your doctor about ways to minimize that risk. Any benzodiazepine should be used with great caution. And I'm happy that so many people here have appreciate just how powerful the mind state of ourselves and even the animals that we eat can be if when it enters our body. So, anyways, I hope that you learned something new. I hope that you can recognize just how sad this case is. And hopefully, if you know someone who's struggling with mental health conditions, or they might hurt themselves or others, that you feel empowered to help them find the resources that they need. Like Neuropilot said it best here, or Uncle Ben, with great power comes great responsibility. And I wonder if we can't flip that around. If we take responsibility, do we gain great power out of that? Try that one on for size. Jody and Patty, you're so welcome. Until next time.